أول محاضرة عن الطب الفرعوني أو Medicine in Ancient Egypt هيقدمه صديق عزيز جدا ليا الدكتور عمر مبروك، وهو رئيس أقسام التجميل في طب عين شمس، وهو عنده انترست جامد جدا في الهيستوري، وهو هيدينا محاضرة شيقة جدا عن الطب عن الفراعنة كان عامل ازاي. طبعا ما كانش فيه اوبست سيرجري، انا كنت قررت قلت له لا البرياتريك سيرجري عن الفراعنة بس ما لناش حاجة. دكتور عمر مبروك اتفضل.
I think the presentation will be in English. My name is Amr Mabrouk, and today we're going to just give a resume about something which is very interesting, that is ancient Egyptian medicine. So why is it important to know? Sometimes people ask themselves, what the hell do I need to know about how medicine was practiced in Egypt? Or why is history essential? Well, just to have an idea, simply that as we look through medicine, it's the same way that we're looking at the pyramids and looking at the building of the structures that we have seen all through our lives. And it's very amazing. And nothing like this could be built without healthy people doing it. So how health was maintained, this is the question. So until 1822, there was nothing understood about ancient Egyptian history. And it was Professor Amr, who is a French linguistic and very much interested gentleman into understanding the hieroglyphics, who was able to decipher the hieroglyphics. However, there was a British scientist at that time by the name of Young, who was also doing a lot of work on deciphering, and he has published a paper in 1817. And this man is a Renaissance man. He was a physician, he was interested in light, he was studying how the retina is able to see, and he was a linguistic. So he did some research, important research about hieroglyphics and about the deciphering of the Rosetta Stone. And why Rosetta Stone? Because Rosetta Stone has inscriptions in 3 languages: the Greek, the Idiomatic, and the hieroglyphic. The other one is the hieroglyphic. And deciphering was made by Champignon. And suddenly, not Pandora's box, but the box has opened, and everybody was started to know information about ancient Egypt. So, what we know is definitely not enough. Why? Because everything was written on papyrus. And papyrus until the 16th century was found very easily all over Egypt. And all these papers of papyrus, they were used in black magic. And all the tourists that came to Egypt in the 16th, 17th, and 18th century used to use this papyrus for nothing but burning them, dissolving them in water to give an aphrodisiac effect. So the papyrus that reaches us is very small. So can we get more knowledge? Well, who are the ancient Egyptians at the start? What do they need? The picture that this picture shows us the type of Egyptians. This is from a noble tomb where Egyptians are managing their lives. They eat healthy food. They eat a lot of vegetables, fruits, and grains. And the amount of meat that they are consuming is few. And therefore, they were having a healthy life. And what type of work they were doing? Of course, they were doing manual work, but at the same time, they were enjoying their lives. And they were very much thinking that the best thing about life is what we are seeing here. That's why this life will not end, but we need to have an afterlife. So how to reach there? They couldn't actually, they were never able to separate the afterlife from the body, and could not imagine resurrection without this. So this is the famous picture from the Book of Death, where they are weighing the heart in front of a feather, and this feather is man, and man is the truth. So if the heart is outweighing this feather, this man is doomed, and he will be thrown to hell. And what is the good man from a bad man? The good man is somebody who is doing good deeds who's not spoiling the river, who's doing, is not harmful, is not doing anything but goodness. And of course, the last thing is about the religion is that they were very clean. They had baths, and for example, the priests who were leading the religion would shower or would bath 3 or 4 times per day, and they would shave all their hairs, and therefore they were surviving quite nicely. So to save the body, we needed to do the embalming, and the embalming that they did was save the body and maintain the body for quite a long time. So what is magic and medicine? Well, in the beginning it was magic, but later on it became medicine. Imhotep is the first physician. Imhotep stands for the word "he who comes in peace," was one of the most influential individuals in history. He was the grand advisor of Zoser in 2980, who ruled Egypt from 2980 to 2900 BC. He was an architect, he built the step pyramid, he was a chief priest, he was the main writer, the scribe, he was an astronomer, and he was a physician. The healer who stood at heart towards the suffering of humanity. He became a member of the Trinity after death. He became a God himself. He was part of the Trinity of Memphis, Bedach, Sekhmet, and Imhotep. And there were 3 temples commemorating the work of Imhotep, and Imhotep himself was teaching in the first temple, and it became a medical faculty in Memphis. And there was another faculty in Deir Bahari and in Thebes. The worship lasted after that until the Christian era for 2 years, for the 2nd century. So what did pharaonic medicine do? It gave us the earliest medical books, the first observation in human anatomy and comparative anatomy, the first experiment in surgery and pharmacy, the first use of splints, bandages, and the first surgical techniques. In summary, it is the origin of medicine. So when Homer, the famous guy of the Iliad, has written about Egypt in 1102 BC, he said, in Egypt, the men are more skilled in medicine than any of the humankind. And women, it is proved that in the Old Kingdom, some of the physicians were women, and midwives were burned all through the history. Now, Hippocrates is the type of person that people thought that he is the father of medicine. He is not, because he got his education in Egypt. And he came to Egypt and studied from the period of 439 to 437. 3 years in a scholarship to learn and teach medicine. The patients were treated in temples, and the whole medical encyclopedia of 6 volumes which Hippocrates has studied. And his work was matching the papyrus that was found. When he went back to Greece, it was easily found that all these papyrus, all his work was related to the papyrus that were found. He said that each Egyptian physician is a physician of one disease, and no more than the whole country is full of physicians. For some, they are physicians of eyes, others of head, and the others affections of the stomach, and more obscure illness. So where is the education done? In the house of life. And what is the source? The scribes, or the writers, who write papyrus. And the teachers were hands-on, and for example, there were famous physicians. The ophthalmologist is known, and Irish, ophthalmology and gastroenterology, and this is something which is very interesting. We received free treatment just before, almost 5,000 years before the NH system. The doctors and the physicians all over Egypt were paid by the state to maintain the health of the people. There were no private practice. The physicians were all employees of the government. There were practitioners, and it was, as usual, Egypt has a great hierarchy. We can find practitioners, chief physicians of the south, and chief physician of the north, court physician, and there is the chief physician of the kingdom, or the minister of health. So, a hierarchy that is 5,000 years old. The Egyptian physicians had to have an oath. They had to examine the patient very carefully, methodically, and they had to treat him ethically. And references have to be consulted. And all these references were the books that they were having all through their lives. There were paramedic schools. There were the priests of Sigmund, the combined physicians and priests. There were veterinary physicians, nursing men, masseurs, physical therapists, pharmacists, and even bandagists. There were schools for midwives. And there were at least 100,000 known physicians. Of them, 150 dignitaries were recorded, and for every one recorded, 1,000 have been forgotten. As we talked about Snap and Ivy was an ophthalmology and gastroenterology specialist. So what is surgical practice? As we are all surgeons here, we have to know. They maintain bleeding wounds, they close them and suture. Bleeding wounds, they stop the bleeding and they use needle to stop the bleeding or to do something like a coagulation. They treated infected wounds by draining abscesses and keeping them clean and using paste from medical plants. And yes, they did refine for head injuries. And this is the patients or the skull of a person that the crime was done and he was saved. He lived afterwards. They mentioned and they talked about all the fractured spines. And for fractures, they did a lot of surgeries. There was the urology, the tumors. The tumors were minimal, simply because the age of the patients was low, and of course, there was no pollution. Hernias were treated and were either reduced manually or they were being coagulated by using some hot baths. Circumcision was a clean habit to protect the skin from infection of the fetus. And here is an example of how fractures were kept safe by slitting a fractured femur that healed very nicely, and a picture of how they returned the fractures into place. And reconstruction, this was the part. The body has to be safe. So a patient who has lost his toe, even from diabetes or amputated, has a replacement of a toe of a material that is matching, and so that when he's buried and emblem, his toe is reconstructed. Dentistry, they are applying golden wires and restoring teeth. And these are some of the instruments that were used. So we have generalists and specialists. So what was the source of information? We have two famous papyrus, and one of them is the Ebers papyrus. Ebers goes to a German archaeologist who has bought this papyrus in 1862, and it's been sent to Germany. It's written in the 16th and 18th dynasty, but definitely has information from the first dynasty. It describes internal diseases, eyes, arms and leg diseases, female heart and blood, and surgery. The Edward Smith was an American farmer who was working in Luxor, and he was very much interested into history. He bought this papyrus, sent it to the United States of America, and is studied in the New York Museum and the Metropolitan, and in 1930 has been translated. And it describes 48 medical cases copied from old ones, and they even describe cyanosis. Ancient Egyptian medical science, of course, they were very clever in anatomy, physiology. They really measured the pulse, and they called the heart speaks. They talked about pathology, oncology, and even described cardiology preparation. When we talk about ancient Egyptian pharmacology, we have to mention that the word enchantment or chemistry comes from the word black hieroglyphics. So all this success and all this information could never have been obtained or could never have reached us except through this gentleman whose the scribe was always present, writing everything and copying from all textbooks, and all these textbooks were kept and very well kept in the faculties of medicine that were distributed all over Egypt. Remember, Egypt was a great hierarchy up till now, and the hierarchy is going on and on. Thank you very much.
Thank you, Professor Amr Mabrouk, for your great presentation. This is very informative, but I had one complaint is that everybody is complaining we have lectures all day, and now we have lectures regarding the nursery. But this is nice. I am proud to present to you, as we do every year, different kinds of music. And today we have a couple playing oud, and we have Ghassan Yusuf and Dina Abdulhamid. They are an international couple. They are the first couple, husband and wife, and they play on the same instrument together, and they are like world famous. They're like this is it for all in the world, and they participated in many musical festivals, and like in Egypt, in Rome, in Kuwait, in Jordan, in Morocco, and many festivities inside and outside the region. And they had the first video clip for the oud instrument. The name is Rahalat al-Salam, and actually it's very nice to look it up in YouTube. It's amazing. And I'm very lucky that I could have them here with us. You know, they teach oud in the Egyptian opera. So please welcome Sumani Laoud, Dina Abdulhamid, and Ghassan Yusuf.